My name is Dr. Cheryl Wellington. I'm a professor and vice chair of research in the Department of Pathology and Laboratory Medicine at the University of British Columbia in Vancouver, Canada. My laboratory has a long-standing interest in Alzheimer's disease. We also are very interested in understanding some of the acute neurological insults, such as traumatic brain injury or stroke, that can happen to people throughout their lifetimes. I think what is really exciting to us is the breadth of potential advancements that fluid biomarkers might make in multiple neurological indications. So in addition to the work that we're doing, that my own research lab is leading in Alzheimer's and neurotrauma, we have developed a brand new core facility at UBC that has a very broad scope of work. And in this work, we have attracted about 122 clinical collaborators now that are interested in using fluid biomarkers for all sorts of indications to assess what is happening in the brain under all sorts of circumstances, from pediatric all the way up to geriatric. So for me, some of the most exciting developments are the potential for biomarkers to be rapidly leveraged for multiple indications and contexts of use, in addition to what we are hearing at this conference on Alzheimer's disease and Parkinson's disease. The other thing that I am very excited about is the potential for fluid biomarkers to move into the translational space, sort of reverse engineering into animal models. We know that there's a lot of interest and important work to do on discovering and validating additional drug targets and interventions that need to take place at the preclinical levels. And to date, the ability to add fluid biomarkers, particularly plasma, into animal model experiments has not yet been taken up very widely. But I do think that Alamar in particular, because of the development of the murine panels that parallel what you're doing for the clinical panels, this is going to be groundbreaking in enabling animal model data to have an anchor in the much more complex clinical landscape. We brought in the ARGO instrument in August, so we've only been up and running for less than a year, but already it's making a tremendous impact. The multiplexing, the performance of the instrument has yielded data at a time scale and with far less specimen volume than we had ever been able to accomplish before. So it is really transforming our ability to access collections of specimens where volume requirements are a big indicator, and also access cohorts where the lead investigators need more than 1 or 2 or 5 biomarkers to be assessed at once. It's also been able to launch discussions on taking the Alamar platform into contexts such as monitoring neurological physiology, say in babies or children that are undergoing surgery. You would never be able to do this using other methods. The performance of the Alamar panels has been exceptional so far. We are uncovering new lines of potential pathways that might be very important in understanding pathophysiology across a number of different neurological indications. As I mentioned, we've been up and running with Alamar for less than a year now. So we have many studies in progress where we'll be reading out the final data and publishing a lot within the next year and a half. We are very proud to be able to launch a new core facility at the University of British Columbia. We aim to have that become an accredited facility so that we can take biomarker work from discovery all the way up to implementation and clinical usage. In addition, we have been informed by our governmental and regulatory bodies that Canada also needs to increase capacity building for running biomarker tests in the clinic. We are partnering with programs that train the medical lab technologists to be able to advance some modules in their curricula that introduce these new technologies the new types of instruments that they are likely to see in the future. So we'd like to take better advantage of some of the Canadian assets that we have in terms of large epidemiological studies on aging. There's so much momentum in this area, and I'm very grateful for the opportunity to be part of the effort to carry this forward.